Today we're going to talk about reflective practice, what it is and why it's important. I'll start first of all with the importance. Reflective practice is a key aspect of learning, both as an undergraduate but also as a future healthcare professional. It's the way that we go about lifelong learning. Overall, it's a simple concept. It's how we learn through experience. And what reflection does is actually to give a structure to do reflective practice. And quite simply, it's do, think and act. Now the doing is about having an experience. It's important that if we are going to reflect, that we have an experience which is worthwhile reflecting upon. Okay, you may find that you don't know the dosage of a drug, and that could be a stimulus, but probably more importantly are those moments of surprise where we're not quite sure about something. We're not quite sure about the way we feel, what we should do next, while we feel angry at a patient, while we feel angry at a colleague, while we may be happy. So identifying these moments is really important, and these act as a stimulus to reflect upon. And the way of getting lots of experiences is to immerse ourselves in practice and our clinical world and working with colleagues. So once we've done something, the next thing is to think about it. Now it's very simple that if we to think that we've got a learning need, such as not knowing the dose of a drug, but probably a bit more challenging is to think, is it just pure knowledge, or is it the fact that we don't have the skills to do it? That would then stimulate us to try and develop skills, maybe searching the internet, looking at books, asking colleagues. But even deeper is our values and belief systems. So even if we do have the knowledge and the skills, we may still be able to have particular learning aspects, such as, why didn't we look it up in the first place? How important is it that we don't show our vulnerability to a colleague or a more senior person? What about the difficulty of sharing our uncertainty with patients and saying that we don't know, we need to look it up? So this is where reflection becomes deeper through the thinking process. As part of that deeper learning and the thinking process, we may look at other issues, such as, why are we doing things the way that we do it? And could they in fact be done differently? And what are the barriers? Are they related to us, to the systems that we're working in, or with colleagues, our interactions with patients? So this is what makes it a much deeper and richer learning approach, the thinking. My personal experience with reflection and supervising people using reflection is that often reflection stops with having the experience and just thinking about it. We don't do anything about it. But I consider that the most important aspect is actually the next one, the action. The action is where we put our new insights into practice. At a simple level, it's just finding the dosage of a drug and putting it into practice. But it may be much more complex, like, for example, if it's related to our difficulty in saying that we're uncertain and we need to look up a drug dosage to a patient, well, we need to look at ways in which we can share that with a patient. That we feel happy with, that the patient feels happy with, and maintains the doctor-patient relationship. So if we say that, the action is really important. So reflection is do, think and act. But does it end there? I believe it doesn't. I believe that we should have repeated cycles of this where we can start putting our new insights into action, and then what we do is to reflect upon those so that we then have repeated cycles. And that helps us to develop lifelong learning, which is meaningful. So in summary, Reflective practice is an essential aspect of lifelong learning for all healthcare professionals. And as a student, we need to develop these skills to help us to become more effective as a future healthcare professional. And remember that reflection is simple. It's about doing, thinking and acting. So enjoy that experience, and I wish you well.